A couple of quotes here. First is from the World Health Organization, which identifies that integrating psychological and spiritual aspects of patient care is one of the most important pieces of appropriate and complete palliative care. That is where this book comes in. This quote is from the Cancer Journal, from an article written by a group who conducted studies with people who were dying and their families. And it reads, often patients and families are thinking about issues of dying, life after death, anxiety about death in the moment of dying, forgiveness issues or questions about God. They may not think it is appropriate to discuss these in the context of a clinical setting. By opening the conversation to spiritual issues, the physician in effect creates the environment whereby patients can share what is concerning them. This quote is from David Kessler, who's written a book, What Dying People Need, which is a very interesting book. But this is from a quote from an article he wrote for the Geriatric Times. The need to express our feelings is universal, and as death approaches, the need to share and speak from the heart grows. Allowing a person to express their thoughts about dying can make the last chapter of their lives profoundly meaningful. From the Canadian Journal of Psychology in 2004, the importance of addressing spirituality in palliative care is becoming apparent. Spiritual well-being and a sense of meaning and peace appear to substantially benefit persons suffering psychological distress at the end of life. I would add that actually there are studies that show that people who can address the spiritual meaning-making dimensions of life in a satisfactory way at the end of life actually report lower levels of pain. This is not an add-on. This is deeply part of what it is about to be human, is to face death and to do the process that requires. I have to mention the spirituality thing just briefly. I have created a book that I believe can be used by people of all kinds of religious persuasions and non-religious persuasions, that it can sit alongside their scriptures from various religions or other sorts of resources. I believe it addresses some universal human needs that have to do with meaning, and that whatever religious orientation might attach to a person's life, that person will have issues of meaning, and perhaps death will bring them to, what's the word I want? A moment that when it needs to really be addressed. Questions of ultimate meaning, the meaning of the universe, the meaning of life, the meaning of my life, the meaning of this moment with this person. These are the things that occupy people who are approaching death, and that has to do with spirituality. Also the yearning towards wholeness and healing. I believe that when people have the kinds of conversations I'm talking about, it is possible to resolve things in relationships. It's possible to settle some things, tie up some loose ends, and allow a person to approach death then with a greater sense of peace. This is from Chief Crowfoot from the Blackfoot tribe in Alberta back in the 1700s. He was recorded as saying, "What is life?" And this is beautiful for prairie people. "It is the flash of a firefly in the night. It is the breath of a buffalo in the wintertime. It is the little shadow which runs across the grass and loses itself in the sunset." Facing Death is a book that is created to address and support the emotional and spiritual needs of the elderly and the terminally ill and those who care about them and for them. It can be a gift for the dying, a resource for busy professionals, an aid to family and friends, a treasure trove of beauty, meaning, and memory,